This is Health Unfiltered, the podcast where we cut through the bullshit and get honest about fitness, nutrition, and mental wellness.
Quick shout out to today's sponsor, the Protein Lifestyle Series by Joshua D. Noland. Think of it as a shortcut to a stronger, happier you. Book 1, Living the Protein Lifestyle. Joshua's story of how he beat depression, crushed food cravings, and dropped 80 pounds, plus the mindset tips you can copy to find success. Book 2, The Protein Lifestyle Workbook. A step-by-step guide that simplifies your transformation into actionable steps. This workbook empowers you to create a vibrant, energized life with clear guidance tailored to you. Book 3, The Protein Lifestyle Cookbook, includes over 40 high-protein, low-carb recipes that taste amazing and torch fat. Grab the trio and reclaim your vitality, sculpt that body, and thrive. Hit proteinlifestylebook.com and snag your copy today. That's proteinlifestylebook.com. Now back to the show.
Melanie, welcome. What's good in the world today?
Everything. Life is awesome. It's good to see you again, Josh.
You
We
too.
saw each other last year in San Diego at the low carb conference, and
Yes.
it's just a wonderful place to meet people and network and learn so much. So, yeah,
It
I've got
is.
so many things going in my life. What's not to like? I'm just enjoying every bit of it.
That's so wonderful to hear. Yeah, the Symposium for Metabolic Health. It was
hmm
such a fantastic event. I learned so much, and I'm really excited to go again
hmm
this year in August.
Yeah, we were just talking about the fact that that wonderful organization kind of highlights a diagnosis on the first day, which I think is a great idea. And of course, last year we heard all of those incredible presentations on mental health
Mhm.
that, it was just so eye-opening.
It
And
was.
then this year, it's my research area. Yay, it's neurological and neurodegenerative diseases on day one. So I am just really looking forward to the research presentations and the networking.
Me too. Yeah,
Yeah.
it's going to be great.
Yeah.
So, in this episode, we'll be discussing your past and current research in Parkinson's disease and your
Okay.
role as the chair for the new Metabolic Health Practitioners Research Academy. But before we
Okay.
dive in, I'd love if you could share a little bit about yourself, maybe your story and what brought you to this
Sure.
work.
Sure. I love to share my story, and it's not because I want any recognition for myself at all. It's that
Right.
I hope that people who are struggling like I was gain some hope from the story that I share. So I've been in health practice for 45 years, and I've been an occupational therapist for a lot of that time, working with across the lifespan from neonates to people in their hundreds that have various neurological conditions. And in 2013, I ended up being the patient on the other side of that picture. And it was such an eye-opening experience, one of the hardest experiences I've been through in my life because I've always been very conscious about health and
Right.
tried to exercise, tried to eat what I thought was right. It was that
Mm-hmm.
low fat, no red meat, mostly
Oh
vegetarian
boy.
way of eating, I know. And I got to 2013 and I had five medical conditions, was on all these medications, and then I was having these health episodes. They were almost like heart episodes or seizure episodes they couldn't figure out, but I would lose consciousness and fall on the floor. And it was,
Yikes.
occurring very rapidly. And so, since the seven specialists I went to, and I now empathize with my patients who go to specialist after specialist and they just can't get any answers. I was there. I was feeling really hopeless. I was really struggling. Well, I ended up at Mayo Clinic and they found a small brain tumor and other conditions and said,
Mm-hmm.
why don't you think about making some changes in your diet? They didn't specifically say what changes, but knowing, of course, that the ketogenic diet was first studied at the Mayo Clinic, I came home and started really studying the ketogenic approach, and then was really led to watch the videos, the research presentations from that first big low carb conference in Cape Town, South Africa, early 2014, I believe is when that took place. And I was like, I have had no idea this research was out there. And doesn't it make sense? I'd been a pediatric therapist, a neonate therapist. I knew that pediatric development, those brains depend largely on ketones and nutritional ketosis when they're being breastfed to just soar in their development. I thought, well, that makes sense. If ketosis can be neuroprotective, what can it do for me? And 110%. I threw out everything I ever knew about nutrition and went cold turkey on almost a carnivore approach. I went way over to the, you know, 80% fat, and I think I was eating less than 2% carbs in my diet. And literally, Josh, within 6 months, I was off my meds. I had, no more medical conditions. I was being able to work out and work out heavy. I never could
Wow.
really lift weights because I had severe fibromyalgia. I mean, for me, vacuuming the house would put me down in bed. When I'd work a long 14-hour shift in the neurosurgery ICU, I'd come home and literally my husband would have my bed turned down and my dinner sitting beside my bed because I could hardly move. Well, 6 months into this approach, I'm off all my meds. I'm working out heavy. I started powerlifting. I'm doing dance aerobics, I'm doing all this stuff. I've lost weight. I got off of CPAP that I had been on for 8 years with severe sleep apnea that they said
Whoa.
could never go away. Well, it did. My
Mm-hmm.
doctor was even so impressed. She said, "What are you doing?" And so I taught her all about the approach. And within a year, I had no more symptoms from the tumor. It was gone. I had no more medical conditions. I was
Wow.
off all my meds, and that was heart meds and blood pressure meds and diuretics and sleep meds and you name it, I was on it. And you know, I, when I experienced that for myself, I knew that I was still on the planet as a gift.
Right.
And my gift was really my new calling, and that was to serve others and to help others with their health. I kind of made a promise to God that I would do that. And literally, I began deep diving into the metabolic health literature, and here comes the SMHP. I mean, the Society of Metabolic Health Practitioners. I was like, this is what I want to do. And just, being able to work with that amazing group of individuals has been one of the many joys. And I'll talk about the Academy in a minute. But my research in Parkinson's, the Colorado Parkinson Foundation, I had a connection with them. My mother's neighbor was on their board. The members of the board, I've shared this before, but the members of their board were really struggling with their health. And I was able to just teach them about the low carb ketogenic approach. And they were getting healthier and getting off meds, and they were so excited that they said, "We want you to conduct research in Parkinson's disease using the ketogenic diet and name your price. You got
Wow.
funding, whatever you need." Well,
Incredible.
that never happens. I mean,
Right?
lowly researchers are out there trying to scrounge funds to do any kind of a study. Well, since 2018, the Colorado Parkinson Foundation has funded all of my research. I've published 5 studies with my team, the wonderful Dr. Dawn White and her husband, Dr. Tim White. We collaborate on publishing and conducting research studies in Parkinson's disease. I'm actually recruiting for my 6th clinical study right now. It is a crossover trial I'd love to tell you about.
Yeah,
So maybe I could do start there and then I got so many things.
definitely.
Um,
You're involved in so
so
much. It's really
I
incredible.
am. Oh, I love it. It's really just it just inspires and empowers and energizes me every day. Of course, I run a small telehealth practice and I love those private patients. I'm
Hmm.
also conducting a study in osteoporosis right now. So,
Wow.
but my current crossover study. So, I've published a 12-week study in Parkinson's disease using the ketogenic diet to test its effects on symptoms of Parkinson's, yes, but also depression and anxiety, which are huge in Parkinson's.
Oh
Dopamine is
yeah.
a huge emotion-centered neurochemical. And so if you don't have the dopamine, you don't get much pleasure out of anything. You're very apathetic, unmotivated, and you're very prone to depression and anxiety. So my 12-week study showed improvement in every variable I tested, which you never really expect as a researcher. So, those with metabolic health conditions got better.
Hmm.
Those with Parkinson's symptoms got better. Those with depression and anxiety got better. That was my 12-week study, and that was published in 22, I believe. And then I extended and did a 24-week, that's 6 months study to see would the results be different for a more prolonged period of time. And the results were the same or better. It took depression symptoms a little longer to improve.
Hmm.
Anxiety seemed to improve kind of in that first 12 weeks, but depression scores on the scales I used, it seemed like took a little bit longer. And I wonder if that's because in my mind, depression's so much more pervasive in its connections in the brain, and perhaps it just took a longer period of time for those elevated ketones to affect that. So that's 12 and 24 weeks. Those were published. I published 2 case studies that I'll tell you about in a minute that were pretty phenomenal results for these individuals. And then we are recruiting for our 6th study. Our first study was an exercise study in Parkinson's. So yes, this is our 6th study. I
Yeah.
published 4 on the ketogenic specific approach. And then this one is, um, I believe, the first of its kind. I could be wrong, but I don't know if I've read any studies that were designed this way or tested the variables we're testing.
Hmm.
So, what I love about a crossover trial is I compare you, Josh, to you through the 3 different interventions. I'm not comparing an average. I'm not comparing you to elderly people in upstate New York. I'm comparing you to you. So, in essence, you are your own control group. So, the first 8 weeks, at baseline, I do some biomarker testing that we do in metabolic health. And then I do some surveys, some scales, some questionnaires, Parkinson's symptom scales. Sleep, cognition, and fatigue are
Hmm.
3 of the factors that I'm targeting this time. And then off you go for 8 weeks and just eat your junky old whatever. I don't have them change one thing. And then at the end of that 8 weeks, I do all the testing again. And the power of that is number one, you're just doing what you normally do, you're your control group. But number two, at the end of that 8 weeks, I give them a snapshot of how's your body loving what you're doing.
Mm,
And I see it as being very powerful because most people think, yeah, I have Parkinson's, but I'm generally pretty healthy and I eat pretty well. Well, when we find out that lo and behold, your hemoglobin A1C is 10 and it's supposed
that's
to be
really
below
high.
5.6, it really
Yeah.
is. It's really very common that I have folks enroll in my studies who never knew they were diabetic and they have been. That's a little surprising to me. Somebody somewhere is not watching something.
Hmm.
But it's very diagnostic for them to see, yeah, my triglycerides are in the 300s and my A1C is 12 and my HSCRP, which is an inflammation marker, is 30 instead of below 3. I mean, it's like, and
Yikes.
and my fasting insulin is 50 instead of below, I like it to be below 3.0. But anyway, it's a very much an eye opener for them. So that first 8 weeks eating your junky old whatever, you're going to get a snapshot of how your body's loving it. And then with crossover trials, you do a 4 week washout between.
Okay.
Phase two is they still eat their junky old whatever. We don't make any changes in their diet at all. The only thing we have them do is add daily MCT oil. Now, why are we having that? Well,
Hmm.
there's quite a bit of research actually on the use of MCT's medium chain triglyceride oil to raise blood ketone levels, the beta hydroxybutyrate in our bloodstream. And Stephen Cunane's lab in Canada is doing a lot of this research. Dom D'Agostino's lab is testing exogenous ketones, that's ketone supplements that you take in, and their neuroprotective effects. There's lots of ketone research going on out there. So the foundation said, we want you to test that. One of the big problems in Parkinson's and other disorders and many of my patients is they're really loath to change their food. Don't touch
Yeah.
my donuts and my muffins and you've seen it.
People get so
I don't want
emotional
to.
about their eating.
Oh,
It's really
they
insane.
do. Well, they do, which to me is pretty good evidence that these foods are very addictive. Your brain
Yeah.
holds on to that addiction pattern. So the
Hmm.
foundation said, what if in the second phase, you just have them add MCT oil? See if it'll elevate ketones on their junky old whatever diet and see if they get any benefits. What a great idea.
Yeah.
So phase two, we use 3 to 5 tablespoons of MCT oil per day. Dr. Bruce Fife has written a book on Alzheimer's disease where he says all we ask you to do is add the MCTs. And he kind of recommends 3 to 5 tablespoons. It really depends on how your blood ketones respond. Some
Hmm.
people can get up into nutritional ketosis with 3 tablespoons. Others need 5 tablespoons to get into that level above zero point 0.5 millimolar. So phase two, the only thing well, no, that's not true. One of the things they're doing is they're adding MCT. The other thing they're doing is we provide them with a Keto Mojo blood glucose and ketone meter. And
Hmm.
they test every morning and it uploads to my Keto Mojo portal. And we start tracking their glucose and their ketones
Hmm.
during phase two. So I want to see, are is this MCT oil making a difference in your ketones? And of course, many will tell you, oh, unless you change the diet, there's no way they're going to get into ketosis. Well, they
But I
are.
would think,
They are. And
wow.
it's they get so excited. I email all my patients every morning. I just do that 7 days a week. And when they hit nutritional ketosis, it's a big celebration. They get so excited. And then that motivates them to keep very consistently with the oil, right? So I love testing. I test my own blood. This is how I worked on my health back in 2014. I was testing in the mornings. I was looking at my diet, what was affecting what.
Mm-hmm.
So it's, to me, data is knowledge and knowledge is power. So, and
It really
then at the
is.
end of it, isn't it? At the end of that 8 weeks, I do their testing again. Did anything change? Did anything improve? And then there's a 4 week washout. They go do whatever they want to do. And then phase three, as you would guess, is a full-blown ketogenic. It's more of the ketogenic end of the spectrum where they're at 70% fats and about 25% proteins and below 5% on their carbs. I want their carbs below 20 grams of carbohydrates, total carbohydrates per day.
Mm-hmm.
And they keep going with the oil and the tracking, right?
Yeah.
And they're doing a dietary tracker for me. So, one of the things that we've just had a few people complete, it's a very long study. They're very hard to do crossover trials. And bless my participants, they are amazing people. They are committed. They are diligent. I've got 15 in the study right now, and I'm recruiting through the end of May of 25.
Mm-hmm.
And they are working hard for the benefit of others with Parkinson's once we publish this research. And the ones who've already finished the study have really said, oh my goodness, I added the oil and my tremors went away.
It's
And some have
incredible.
said, yeah, some have said, oh, I added the oil and my tremors really reduced.
Mm-hmm.
Or I added the oil and my mobility was better, or my sleep was better. Some of them have said, for the first time since my diagnosis 10 years ago, I slept for 7 straight hours. I mean,
Wow.
they're really, they're starting to have some really, really good results. Of course, everybody's results are different, which is the beauty of a crossover trial. So I'm so excited about this study. I can't wait to finish data collection so we can start analyzing the data and get this published.
Yeah. So how long is the entire study for each participant? It's the 8 weeks, the three different phases, and then the two 4 week washout phases.
Yes, so it's a total of about 32 weeks. It's a long time.
Yeah, it
And
is.
they're meeting with me a
Mm-hmm.
lot. They're testing their blood. I'm sending them materials. I set up a Google Classroom for my participants, and it has
Mm-hmm.
videos and handouts and food lists and sample menu. I mean, you name it, it's all in there. And they can go in there and kind of poke around and watch different things. And I have a very tiny little YouTube channel where I post research for them to go in and watch my different research talks. And I
Mm-hmm.
talk about the practical ways to apply a ketogenic diet. So it's just been a lot of fun. I know it's not fun for them so much maybe, but I am having a good time just getting to know them and encouraging them. And all of their study fees and costs and everything are paid for by the foundation. The foundation pays for their blood work and they're getting baseline, and after each phase,
Mm-hmm.
the foundation pays for their meter. It pays for the supplies for the meter.
What a
It's
blessing.
just it really is. It really is. Of course,
Yeah.
I don't take any money for my research. I do this because I love it and I'm here to serve my patients. So,
Mm-hmm.
yes, I'm
Yeah, I
excited about the crossover.
me too. Yeah, it sounds incredible. And I mean,
Yeah.
it's so there's no exercise or any physical activity as part of that study. It's just the diet and the
No,
MCT oil.
right. I just cut it down to those variables because as it is, I've got like 10 variables I'm testing.
Yeah, it's a
And
lot.
yeah, you wouldn't be able to really figure out what the effect of exercise was. However, my very first study that I published in 2019 that I conducted with a PhD student of mine was an exercise study. And the beauty of that study is with the help of the foundation, I was able to set up exercise programs in local YMCAs in the Colorado
Oh,
Springs
cool.
area for people with Parkinson's and people without Parkinson's. So everybody could do the exercise program. And then my student and I tested everybody's balance and strength and mobility and lots of things at the beginning and then at
Hmm.
the end of 8 weeks. And
Yeah.
it showed some phenomenal results in terms of quality of life and willingness to socialize, some balance results, some mobility results. So I am a big believer in exercise for sure.
Yeah. Yeah. I mean, I really take a holistic approach to health. I think you need the diet, the
Right.
exercise, and to focus on the mental health. And
Absolutely.
I'm sure it's got to be difficult for, as far as designing the studies, you're not able to test everything at once. You have to keep the
Right.
a limited amount of, different things that you're looking at so you can get accurate results.
Right, right. And it's all about just the study design and then the way that we will analyze the data. But the beauty of doing research too is standing on the shoulders of those who've done research before.
Hmm.
And I have used a lot as my foundation for my research. The research that Dr. Matt Phillips does in New Zealand on Parkinson's disease, Stephen Cunane's research, Dom D'Agostino's research, a lot of the research that's been done on the gut microbiome in Parkinson's. In fact, I'm working
Yeah.
on another study that I probably won't recruit for until 26. I know it's like, I want to do it now. I've gotten so excited about the gut microbiome and its connection in brain disorders that I'm just chomping at the bit to get that one IRB approved.
Hmm.
But just learning more that I can use to help my patients and that I can publish. And publishing our research is my big goal behind formulating, creating from scratch the new SMHP Research Academy. So
Yes,
it's a great segue to that topic.
definitely. I did want to ask you about your research in osteoporosis.
Sure. So I have a personal passion for the subject of osteoporosis. My mother
Hmm.
died from complications from osteoporosis.
Oh
She
man.
had been on the conventional treatment, the medications for 30 years
Oh boy.
and had a terrible fracture. She didn't fall. She just stepped on her foot to pick her other foot up into her car, and her bones in her ankle disintegrated. And
Jeez.
she'd been on the conventional treatment for
Hmm.
30 years. And that caused other complications. We see this frequently in
Yeah.
osteoporosis. They'll have a fracture, and then one thing leads to another. And so, since that happened, I have really developed another passion in my metabolic health practice for women with osteoporosis. They're basically told medication's your only option. Go on them or you're going to fracture, which isn't true.
It's ridiculous.
And yeah, and most of these medications really mess with your bones' natural metabolic processes and cause them to be out of balance. And what happened in my mother's case is she was on, something like Boniva or something. And what it does is, I believe that's the one she was on, but what these meds do is they shut down your bone's ability to break down and clean up old damaged bone. and it like boosts your ability to build bone. So what you're doing is you're building new bone over old rotten scaffolding.
Mm.
And so what is one of the major side effects to those medications? Fracture. Okay. You've
It makes
really messed
sense.
with, yeah, you've messed with that balance. We have to
Yeah.
have bone breakdown to have bone buildup. It's
Mm-hmm.
in balance, as a lot of our processes in our body are created to be in balance.
Yeah.
And so I have recruited 5 women for a case series that I'm doing in osteoporosis. And we're looking at diet and exercise and supplementation.
Mm-hmm.
So we're taking their baseline DEXA and bone markers that we have tested through blood. And then for a year, they're implementing my exercise protocol, my supplement protocol, and then the diet, taking out grains, taking out sugars, taking out processed foods.
All the
Now,
nasty
some of
stuff.
them, right, it's more low carb. So some of them won't need to go fully on the ketogenic macronutrients. They
Mm-hmm.
can be down here in the low carb area, which is the beauty of this approach. I've heard people criticize saying, oh, keto can't cure everything. Well, there are all grades of keto. There is a
Yeah.
continuum of therapeutic carbohydrate reduction that we use according to
Mm-hmm.
what you're working on, right? So, Josh, at your age, if your blood sugar's pretty good and your markers are pretty good, but you really want to work on your blood pressure, okay?
Mm-hmm.
So, if you have some elevated and your weight's good, if you have some elevated, maybe HSCRP inflammation, then we would focus on adjusting your diet to remove inflammatory foods, right? And look at your daily blood glucose. What's it coming in at? Okay, yours is pretty stable, fine. So you could maybe eat up to 100 grams of carbs a day and be just fine and do well.
Yeah.
Whereas somebody like me, I really feel like I had a huge carbohydrate intolerance. And I can tell you
Mm.
now, all these years later, 12 years later, I still eat mostly carnivore. I add some dairy because of my age for the calcium benefits, and I
Yeah.
actually make my own probiotics. So
Oh,
I do
cool.
that.
I'd
And
love to learn more
yeah,
about that.
oh, I'll talk about that in a minute because that's
Yeah.
one of my new like binge things that I'm doing is looking at that research. But anyway, so we're all different. My husband, who's 6'8" and very thin and very fit, he eats more like 200 grams of carbs a day and he's just fine on that.
Mm-hmm.
Me, if I eat too much more than about 20 grams a day, my body's not liking it.
Yeah.
So we're all it's very customizable. That's the beauty of
Mm-hmm.
this
I love that.
approach.
Yeah.
Yeah.
And everyone's
So
so
what I
different.
hoped, oh, they are. So what I hope to do with this osteoporosis research is everybody will finish their 1 year DEXAs in early to mid 26.
Mm-hmm.
And then I hope to publish that in the new Journal of Metabolic Health. I'll put out that plug.
Yes.
But
And
very,
I'd
very
love
exciting research.
to have you back on so we can discuss
Okay.
the findings of those studies that
The
you're currently
results.
doing. Yeah,
That'd be
definitely.
great. I'd love that. And since it's a case series, it
Mm-hmm.
again is each woman's case and what they do because that emphasizes to me that we're all very different as human beings. Our
Yeah.
bodies are going to handle things differently, and I think that's really the beauty of doing a case series.
Yeah.
Sometimes when we get focused on only looking at randomized control clinical trials, we're really neglecting all this research that really adds to our level of knowledge and
Mm-hmm.
expertise. So, yeah, that's a case
Definitely.
series that I'm working on.
Very cool. Yeah, I'm a huge
Yeah.
advocate for the elimination diet. where people get
Yes.
off all the junk for a while, let their body kind of clear out, and then start adding things back in, and they can see specifically what their bodies don't react well to, and they can adjust from there. I think that's really helpful. I
Isn't
talk
that the
about that in
truth?
my
Absolutely.
IBS book.
Absolutely,
God.
you do. Very helpful book. Yes, I've recommended it to several of my patients
Oh,
who have
thank you so
ongoing
much.
IBS. Yes, absolutely. It's very practical. And that's what they want. They don't want another book
Yeah.
about theory. They want
Mm-hmm.
some practical, what can I go home and do?
Right. There's some
So,
recipes in there and just
yeah,
common sense
very
stuff
much.
that's in common terms.
Absolutely. Well, and the research on the gut microbiome, and I have to tell you, for years I've kind of been skeptical of the whole probiotic craze, right? I
Mm,
just I didn't know enough about it, and I wasn't like, okay, I don't know if these really did well.
yeah.
So I was on an interview with Brian Linskus back in the fall, and he started talking about the gut microbiome research in Parkinson's, and I went, "Oh, I haven't read that research." And so he kind of created a monster. So I took off running in terms of really deep diving into the gut microbiome, in terms of its relationship to not only inflammation, but the creation of the abnormal proteins that then travel to the brain and become some of the amyloid plaques that we
Mm,
see in
yeah.
Parkinson's.
Yep.
So really, the research is suggesting, has nothing's been proven, but it's suggesting that people with Parkinson's start with problems with their gut decades before they ever get their Parkinson's diagnosis.
Hmm.
And if we can intervene decades before, will they not develop Parkinson's, whereas they might have if we didn't address the gut?
Yeah.
So fascinating topic.
Yeah. I definitely think probiotics are really important if you're eating plant foods. A lot of those fibers are
Mhm.
indigestible, and you really need those
Right.
probiotics to help break them down. So,
Sure. And not to mention all of us, and I don't know about your generation, but my generation, everything was hit with an antibiotic, didn't matter what it was. You have a sniffly nose, they hit you with antibiotics as a child. I had ear infection after ear infection after ear infection from the time I was maybe 3 years old, clear up. I think I had my last ear infection is at 12 or something. So I
yeah.
was having antibiotics all the time, all the time.
Hmm.
And I developed peptic ulcers. So throughout my high school and college, I had ulcers. And of
Oh
course, the
man.
only way they were treating those with just, over the counter meds or whatever. Well, reading this research, I'm like, yeah, I killed off everything with the antibiotics for 8 years or something.
Hmm.
And then, yeah, I developed peptic ulcers and struggled with ulcers and stomach pain throughout my teenage years and college years. And then, lo and behold, my daughter is born. And from the time she was born until she was 11 months old, we never cleared up her ear infections. She was on antibiotics the whole time, if I knew then
Wow.
what I know now.
Yeah.
And I was doing a homemade probiotic video on my YouTube channel, and she was viewing it, and she said, "Mom, I've had SIBO for years. I've had gut issues for years. I've had chronic this and chronic," and I didn't know she'd been struggling with this, but it makes perfect sense because she'd been hit with antibiotics almost her whole
Hmm.
childhood as well. Well,
Yeah.
she's been on the probiotic fermented dairy that I taught her how to do. And she said, the benefits to her gut have been amazing. Um, and I didn't think I had any gut issues now, but what they do to Josh, that I'm finding that I'm interested in Parkinson's is they affect your sleep quality. They will make you sleep
Really?
deeper.
Mm, I had no idea
So,
about that.
yeah, I mean, they also create ketones,
Mm-hmm.
especially butyrate,
Yeah.
and that can also affect the brain.
Yeah.
Muscle recovery is one of the strains that I use. And being a power lifter, I always would the next day after lifting heavy be really sore. I mean,
Hmm.
really sore. Like getting up and down out of a chair is a little challenging. Anyway,
Right?
I've been on this regimen since January, and my muscle recovery is almost instantaneous. It's rather astounding. I did not expect that.
Wow.
So, so anyway, I'm just really, like I said, binging on this research. I'm so excited about going further, learning more.
Definitely. Well, let's talk about the Research Academy and then we can get back into probiotics.
Wonderful. So, January of 24, I woke up with an idea. It's like I have my best ideas between like 2 a.m. and 6 a.m. Anyway, one of the things I do as a university professor is I teach my PhD students how to read and interpret research studies. And then I teach them how to design their own research studies for their PhD research. That's just part of what
Hmm.
I do
Yeah.
for my 3 universities. And so I woke up thinking, here we need more research in our area, metabolic health. Here we have all these members who are practicing. They're out there with patients and clients, and we have coaches with clients, and we have doctors with patients, and we have all this data.
Hmm.
I said, the problem is the lone provider out in Jal, New Mexico, has no idea what to do with all this data or even how to think about conducting a study, doing an analysis, and publishing.
Hmm.
So here we're telling them you need to be publishing, but we're not telling them how. So I sat down and in about 3 days, I mapped out the new SMHP Research Academy. And it is a comprehensive, it's almost university where you can go in and do 10 training modules. There are 10 right now. There are going to be more. 10
Hmm.
training modules that walk you from step one to publication. They're short modules. You work through them. My daughter-in-law, who is a master teacher at learning theory and methods, she created customizable notes according to your learning style that
Oh,
you can
wow.
download and take notes on each of the modules, create a notebook of all this
Hmm.
information. She even created a cover for your notebook. And then when you finish the 10 modules, you get a certificate of completion from the SMHP.
Sweet.
So that's just one thing the Academy offers. We have a faculty of research mentors, and these are individuals with expertise in certain areas of research. We have a quantitative research mentor who is an expert in secondary data analysis methods.
Hmm.
We have a qualitative research mentor who's on my research team. I kind of drug her to the SMHP. Anyway, she is a master at qualitative study design and using surveys and interviews and thematic analysis and everything that is certainly not my area of expertise. We have a literature review mentor who I drug from one of my universities, and she is really good at helping you write the literature review for your study, looking at the sources you've gathered, summarizing those sources, having good foundational research for your study. Then we have a data analysis mentor who is the wonderful Dr. Adrian Sotomoto, who is like this data analysis. He can just do data analysis in his head. Um,
Mm-hmm.
he he will help people, members to design their data analysis approach and look at their statistical design and what they want to do there. Our research mentorship chair is Kelly Sauber. She is kind of herding that group and getting people assigned when they sign up that they have a project idea they'd like to do. Who did I forget? Hopefully, I didn't forget any. Oh, Dr. Laura Buchanan just joined our mentor program. She's amazing. She is our publication mentor. So you
Mm,
get your manuscript kind of almost ready, and she helps you get that thing published. So it's
nice.
just a fabulous faculty. Another thing we offer is the journal club. It's every quarter. It's not your typical journal club. We take a research study and we evaluate it.
How
How,
fun.
what was the quality of the design?
Mm-hmm.
How was the data collection? Could you really understand what they did? What are the strategies? How good do you think their analysis was? What were the strengths and weaknesses of this study? And what that's doing is it's teaching the members how to design their own study. Oh, that's a great study design. I can do that one. Or, oh, this was kind of a weak design, so I need to think about that. So I've created an evaluation tool that we use to analyze research that's been published. And we go over the pros and cons and strengths and weaknesses, the level of evidence. It's kind of a classroom setting where we go back and forth and I ask questions and they respond, and it's wonderful. We had 80 participants in our last journal club. And the next one is June 21st, and Dr. Sotomoto is going to do an emphasis on data and data collection and analysis. So that'll be fabulous.
Very cool.
So, yeah. So, did I forget anything? Oh, and of course, we do training on how to publish in our journal. We
Mm-hmm.
really support the Journal of Metabolic Health. And so I have training on that and mentors to help you navigate that space and get your article published. So it's a
Very
lot.
cool.
I tell people it took me 9 months to fully launch this thing. It was like having a baby. So the Research Academy baby has been born and it's just up and running and people are really getting excited about it.
Yeah, yeah, I'm really excited about it. And it seems like you've got, all the different aspects of creating and publishing and, qualifying
Right.
the studies, everything. And
Yeah,
that's amazing.
it's all in there.
Do
Yeah, and we're
you,
here to help.
yeah, it sounds like it. It's a very supportive team.
Uh-huh.
Um, so do you have to be like a doctor or like a scientist to conduct a study?
Not at all. In fact, we have a health coach who is working on a scoping review of dietary guidelines in sport nutrition.
Oh, wow.
Um, so yeah, you can be anybody who has an idea. If you're a health coach with clients, we can use that data.
Mm-hmm.
It depends on what kind of a study you're doing, whether you need institutional review board ethics or coverage approval or not. Most of
Yeah.
the time you do. But if you're
Mm-hmm.
doing a literature review, you don't. There's some study designs you can do that are what they call exempt. So if you're sending out an anonymous survey to your clients, and you get back data that's completely de-identified, that may
Mm-hmm.
be an exempt study.
Yeah.
So we also have information in the academy to IRBs, institutional review boards, which are required by the NIH for conducting human research. If you don't happen to be associated with a university IRB, so another thing we have is some of our mentors and myself, we're connected with university IRBs.
Mm-hmm.
So if a member comes to us with an idea that requires IRB approval, it's possible that we can serve on that research as the primary investigator along with them and get IRB approval for them. So that criteria is also spelled out in the academy. when I was developing the academy, I said, okay, there are going to be individuals out there who need an IRB who are not associated with the university. So I interviewed five open access public IRB companies and got their information and presented on a chart so people can go in there and go, okay, this company does this and this and this. Here are their typical costs, and it compares to this company who does this and this and this. So we've got just about everything you need in there
It
to
sounds
start a
like it.
study.
Yeah,
Yeah,
I love it.
yeah.
I wanted to ask you
It's yeah,
about studies that are funded by like industries. Like back in the
right.
1960s, there was I think the Heart Association did a study on fat, and
Hmm.
I think some of the doctors or scientists were paid off by the sugar industry to support that the idea that fat was bad
Right.
for you and take the blame away from sugar. How do you guys identify, studies that are paid for by industries and are like fraudulent like that?
It's a really good question, which is a big focus for the Journal Club. We want
Hmm.
you to be able to pull a study and say, okay, what is the credibility of the study? Who funded it?
Yes. Hmm.
Who do the authors work for? It's one of the things that we look at.
Some big
Now,
indicators right
two,
there.
right, two things about industry funded studies. Number one, the big RCTs are expensive,
Hmm.
and therefore the funding is really oftentimes only available through a big food or a big pharma
Yeah.
company. It's not that I'm opposed to these organizations funding research. What I'm opposing to is they're not disclosing their funding associations and potential bias in the
Mm.
interpretation of their results. It's
And they
just
don't
like, you know,
publish the results, they only publish the interpretation, is that right?
a lot of times they won't publish the data, which is kind of suspect.
Right.
You want to be able to view the data because a lot
Hmm.
of times they'll do the results. And when you look at the data and analyze it, it doesn't say that at all.
Right.
So that's another weakness that we look at when we're analyzing these research studies. So yes, industry needs to fund research. I get it. But you need to say this research is funded by Ozempic, the
Hmm.
Ozempic company, and therefore our findings may contain some bias. You need to be transparent in your disclosure of conflicts of interest. And
Yeah.
that's not something that I'm seeing that a lot of these industry studies really disclose. On the flip side of that, Josh, it's really incumbent upon you and I, with our clients and patients, to educate them on.
Mm.
Here's an example. Just this morning, a friend of a friend texted me and said, I'm going to see my doctor. He's going to have a fit about my cholesterol. He's going to push a statin. I don't want to take one. What do I tell him? And I said, well, number one, the studies he's quoting to you were all funded by the statin industry. He
Course.
needs to realize the inherent bias in those results.
Hmm.
And what I sent her with studies, I sent her five studies that were independently funded by the researchers,
Yeah.
had no connections to the statin industry. And one of them gave a very nice balanced view of the use of when statins are appropriate and when statins are really not needed. And I think that is our responsibility as metabolic health practitioners, is to say, here are the things you look for when you're receiving medical information. Here are the
Hmm.
good websites, the reputable, credible websites that you look at. Here is the thing you need to recognize in this study interpretation. Do
Yeah.
you think a researcher who is working for Coca-Cola is going to put in his findings that Coca-Cola is deadly? Oh, no,
No, definitely not.
not.
They'll
No.
lose their funding.
So Yeah, so I'm all about transparency and disclosure of bias and conflicts of interest.
Yeah.
I'm not saying that it's bad that industry funds research. No. But I am glad that non-industry actors are also funding research. You can have that balanced view.
Hmm.
And that's really what evidence is. Evidence is looking at the totality of what's been done on a topic. And through this analysis of the credibility of the studies you're reading, you try to
Yeah,
select the best evidence. So
definitely.
I do that a lot with my patients. They get tired of hearing me harp on it. But, and then the journal club really, we go through that when we're analyzing a study.
Is
So
that
I have,
available
uh,
just to members of
yeah, just to
SMHP or?
SMHP
Yeah,
members, right? Yeah,
very
it's one of the
cool.
big perks. The perks.
Hmm.
I'm hoping, I told Dr. Sotomoto, I said, I want you to analyze a really terrible study. I want you to find the worst study you can find and really pick it apart for us because we need, again, to have that balanced view of here are some good methods, here are some methods that maybe aren't so good.
Hmm.
Um, it's never a good idea, I think, to really not disclose your conflict of interest. And I do when I speak, I always say, disclosing my bias. I've been low carb ketogenic for 12 years. I believe in the approach. I use the approach with my patients. So you have to
Hmm.
realize that what I'm presenting to you is from my personal bias of what
Yeah,
I've seen and experienced.
and you
So,
believe it, and you
and
live
I
it.
believe it. I live it. Yep,
Yeah.
I sure
Yeah, it's
do.
it's sad. I mean, I feel like a lot of people don't take the time to do their own research or even read studies. They just kind of look at the conclusion or even just take the
Right,
word of their doctor. And
right.
I mean, are there appropriate times for statins to be used?
Yeah, I mean, there is some evidence. It's not strong evidence, but there is some evidence that in people who have already had a heart attack, had
Hmm.
a cardiac event,
Yeah.
or a stroke, that statins can help reduce the inflammation and the
Mm.
risk for having a second event.
Yeah.
And, statins do have an anti-inflammatory benefit. They do.
Right.
But are they needed in all these cases? And should they be put in our drinking water? No, they're
Oh.
not right for everyone. And for women, especially,
Mm.
they're not they're not necessarily right because in women we need that cholesterol to develop for our that really contributes to the development of our hormones. And women really, their threshold for total cholesterol is more in the 240 to 260 range.
Hmm.
And that is certainly not something you'd hear a conventional MD say. They just really don't have the training, I believe. But bless them, they don't have the time. And I get it. We have overtaxed them. They have,
Hmm.
7 minutes with a patient.
Yeah.
They're over,
It's
they're
crazy.
understaffed. They don't have time to do the deep dive into the research like a clinical researcher does, like I do. I'm in the
Hmm.
research every day. So I want to say that I work with my MDs. I love my MDs. They are doing their best and
In
they
the
are
trenches.
master. Oh, they are. They are masters at acute conditions. You have an infection
Yes.
and you really need an antibiotic, let's hit it. They are masters at that. They are
Yeah.
not masters at metabolic health conditions. We're the masters at that.
Hmm. Treating the root
So,
cause. Yeah, I'm
that's
really
right.
excited for your blood work series to come out. I saw that was pending on your YouTube channel, and I was interested in that lipid video. See your
Very
take on
good.
that.
So, you've been doing your homework. Good for you.
I
I have
have.
gotten pretty excited about posting short reviews, short videos on things I'm asked about all the time.
Mhm.
There's probably not a day goes by that I don't get an email or a text from somebody who knows somebody who knows somebody that I know saying, my triglycerides were this. What do you think? Or my this, and my doctor says I'm just fine, but I don't feel fine, you know. So I thought, okay, I'm going to do some brief, and they're brief, Josh. They are not in detail, in depth.
Mm-hmm.
I am not a biochemist, but they're brief, looking at what's a good range, what's a typically a good range in these different labs that you have drawn every year. Some of them.
Or
Some
should
of them
be.
you don't have drawn up every year, but you should.
Yeah.
Yeah, and that's one
Mm-hmm.
of the things I talk about in some of these videos is, you know, your doctor's very limited on what they can order for you. They just are. They're
Yeah.
constrained by the health system they work in.
Such a challenge to
But,
navigate that, the insurance side of it
oh,
too.
I
It's
know.
it's
Oh, it
insane.
is. It is. So I don't blame them,
Yeah.
but I empower my patients to order their own blood work.
Yeah.
And there are websites with some really reasonable prices that you can order a fasting insulin because the doctors don't know what it is and they won't order it.
Mm-hmm.
So yeah, I'm excited about the blood work series. I've got all these videos that are pending. What happens is I get on a roll and I'm like doing videos, and I go, oh, I usually post videos on Mondays. So it's like, okay, I've got all these videos clear out through like July now
Mm-hmm.
that are due to come up. But I'm glad you saw the upcoming because I want to kind of tell people what to expect, what's coming up, what they might be interested in. It's a
Yeah.
variety of topics too. Parkinson's, yes, but I also
Mm-hmm.
post on osteoporosis, metabolic syndrome, insulin resistance, the gut.
Such a wealth
My
of
cooking,
knowledge.
I know my cooking demonstration where I showed people how to make their own probiotics. It was like it's like my most popular video. People are like, I need this. I have gut issues. So that's
Well,
been
tell
fun.
me
That
more
was
about
kind of an,
that.
yeah. So um, in my research on looking at the gut microbiome in Parkinson's,
Mm-hmm.
I came across Dr. William Davis and his work in SIBO and SIFO, and that small intestinal bacterial overgrowth, small
Yeah.
intestinal fungal overgrowth, and some of the probiotic strains that he has researched. And I bought his book, Super Gut. And again, it's like, wow. I I love life because you're always learning. It's just so cool. And so I really did a deep dive into the three strains that he uses in his SIBO yogurt ferment, his SIBO fermented dairy protocol. I call
Mm-hmm.
it yogurt. It kind of turns out like yogurt, but it's not yogurt. Anyway, so the L-reuteri, the L-gasseri, and the L-coagulans strains and what they do, some of the research behind them. And so in this video, I go through the microbiome and kind of the function of the microbiome and how many organ systems the microbiome affects, what kinds of conditions that you'll have if you have a problem in your microbiome. And
Mm-hmm.
then the last part of the video, I actually am in my kitchen and I do a cooking demonstration on how to make homemade medical grade fermented dairy using these three strains specifically. And, you know, I have so many patients now doing the dairy and then experimenting with what if, you know, my major problem is sleep. So what if I pull the L-reuteri out and I just ferment that by itself? Fine.
Mm-hmm.
Wonderful. Easy to do. Simple. You can put together a batch in like 5 minutes. It's just so ridiculously
Wow.
easy. You wouldn't think it works, right?
Mm-hmm.
So, but it really does. And I now am experimenting with L-plantarum, and L-plantarum has been widely studied in Parkinson's, and it's
Really?
showing some excellent results on the motor symptoms in Parkinson's.
Mm-hmm.
So I'm doing a research video today actually on the use of L-plantarum in people with Parkinson's. I'm reviewing a study that talks about the motor benefits of being
Mm-hmm.
on L-plantarum fermented either a fermented product or even just the capsules, and to note any changes in the motor symptoms. I'm always about helping my patients with their symptoms with the most natural approach they can find.
Yeah.
So, but the fermented dairy is really fun. And my people with irritable bowel and chronic colitis, they are raving about how they feel
Hmm.
on this new fermented dairy approach.
Wow.
So, more to come in that because I'm going to research that. I'm going to do that, and I'll probably recruit in 26 at some point. I got to finish the one I'm doing,
Oh
the
yeah,
two
you've got
I'm doing.
so much going
So
on. It's really
I
incredible.
know.
So
I
what's
love it.
the base for this fermented dairy probiotic?
So you can make it two different ways.
Hmm.
If you don't do dairy, you can make it with like coconut milk,
Oh,
right?
cool.
What I'm finding is across the board, my patients are telling me, oh, I've been lactose intolerant I can't do dairy. I can't do that. Well, what it is not a true lactose intolerance. It's actually an overgrowth of a dysfunctional amount of microbes in the upper GI tract.
Hmm.
And when you get that fixed, guess what? You may be able to eat dairy products,
Can start
right?
having cheese again.
Yes. So it really just depends on you as an individual. Now, if you really can't do dairy, you can ferment this product in coconut milk. It takes a little, you have to do a couple more steps. One of
Yeah.
the problems with these strains is they're very strong, but they're also very susceptible to other strains in non-dairy products or dairy products. So you have to actually superheat products as an additional step, like raw milk. People have asked, can you make it with raw milk? You sure can, but there are so many active microbes in raw milk that
Oh
they'll
yeah.
actually compete with these strains and they won't be as
Mm.
effective. So you have to superheat the raw milk or the coconut milk to 180 degrees
Might
for
as well just use
10 or
pasteurized
15
milk at
minutes.
that point.
Sure. So the best result that I found is the ultra pasteurized half and half because you get
Oh.
that good fat,
Mm-hmm.
right? And low or no carb. In fact, after this is fermented, there are no carbs
Oh wow.
in this dairy product because the strains will eat the
Microbes.
lactose.
Wow.
They feed
Oh
on it.
cool.
So I have made it with heavy cream and it was like butter. It was so thick. I mean, it was like that kind of thing. It was good, but I
Mm-hmm.
really prefer I use organic half and half. You
Yeah.
have to have a way to ferment it. And so you either buy a yogurt maker or if you have a sous vide, you can use a sous vide
I was gonna
as
say
long
it's
as you
sous vide,
can.
yeah.
Yeah, you can certainly use a sous vide with mason jars. That's how I do that too,
Mm-hmm.
because I make so many batches of it now. And as long as your device allows you to set it very low in temp, these strains like body temperature, which is like 100 degrees up to about 102 degrees is where they like
Yeah.
to live.
Very
And
low.
then you can set it, it takes 36 hours to ferment this product. Now,
Mm-hmm.
most of the yogurt you find or the probiotic yogurt you find in the store has strains that do not benefit the upper GI tract. They all
Mm.
like to live in the colon, right?
Yeah.
Number two, they're only fermented for 4 hours. So you're
Wow.
not getting high counts of probiotic at all.
Mm-hmm.
So this fermented dairy ends up at 36 hours with over 300 billion CFUs.
Wow. That's a lot.
Whereas it is. Whereas most probiotics you get are what? Maybe 200,000 or
Mm-hmm.
they're not very high.
Yeah.
So the beauty of fermentation And you can ferment all kinds of things. You can ferment kefir using this product. You can ferment, they even have, I don't do it, but they even have ways you can ferment different vegetables using this approach. So
Oh,
fermented products are very, very good for the gut, as you
yeah.
know.
Mm-hmm.
But what I find is this fermented dairy product really is helping with sleep and muscle recovery and upper GI issues, specifically things like GERD, um, problems in the upper GI tract. Like a lot of IBS sufferers, it's in the small intestine. That's the problem. But then also these strains will live in the upper GI tract. They prefer that. Whereas the
Yeah.
strains you get in other probiotics, they head straight to the colon. So different strains to fix different things. That's the beauty of what I'm learning.
Very cool.
So yeah, you have to check out my cooking demonstration. I know you do some cooking too, so it was a
Definitely.
lot of
Yeah.
fun.
People are gonna have to watch your YouTube video to learn how to make it. The exact
That they'd
process.
be welcome to.
Yeah.
Yeah,
And
it's
it's
very fun. I really go into a lot of depth. Yep.
I believe it. You're all about the details. And it's really
Yeah,
incredible. I find that most products that you can buy in the store are very inferior to things that you
right.
can make at home. It's just
That's right.
the whatever, it's the process, the manufacturing process, or the having to make it shelf
Right.
stable or whatever it is. It's just not as good as cooking your own food, making your own probiotics, whatever it is, just making it yourself. It's so much better for you.
I agree with you 100%. And that's why I am all about what can you walk to your kitchen cupboard and pull out? That'll help you. What can you drive
Mhm.
to your local grocery store and pull out? That will help you, which is why I don't use exogenous ketones in my research.
Yeah.
Um, they're very expensive. And
Mhm.
as I've said on other interviews, my patients can barely afford the meat they're supposed to eat on this diet. I can't ask
Right.
them to spend all this money on exogenous ketones when what I'm finding is they get good benefits from, even if they can't even afford the MCT oil,
Mm.
use the cold pressed coconut oil. You can grab that off the shelf.
Oh yeah.
If that's all you can afford, you'll get some benefit from that. So,
It's good to
yeah,
know.
yeah, I like the natural approach.
Me too. So,
Yeah.
in addition to all your research and all your videos and everything else going on, you've got your third book's coming out this summer.
It sure is, and I'm glad you asked about it. So it's like, okay, my husband's just kind of like, what are you doing now? I'm like, oh, I'm working on my book, or I'm working on my research, I'm working on, whatever. I'm working on my YouTube channel, whatever. So yeah, I have a passion for families. Bless them. They're the ones who have to end up taking care of people. If we don't educate them, what are we doing?
Yeah.
So my first book was about how does a family navigate the intensive care unit. Has
Hmm.
anybody ever taught you how to navigate the intensive care unit? I'll bet
I
not.
wish they did.
So I
Yeah.
know, we'll all have someone we know or love in the intensive care unit. That was my area of expertise for 30 years.
Hmm.
Neurosurgery intensive care, which was
Yeah.
fabulous, wonderful. Love those patients, adored those families. So, my first book is Families in the ICU, a Survival Guide. How are you going to get through the ICU? What are the questions you need to ask? What's the role of the different people who walk through that door? What is common terminology that they're going to be spouting off? Uh, I actually based that book on my doctoral research that I did at my hospital, and I had a control group who got basically just information on local restaurants and things to do when they're in Albuquerque. And my experimental group, which got the draft of this book.
Hmm.
And my doctors were like, we know who's in your experimental group. Well, you can't tell me, la, 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 la. They said, because they're the ones we walk in and we say subarachnoid hemorrhage, and they flip to their book and go, oh, that means this, right? I said, see, they breeze in, they're so busy, they're so understaffed and overworked, and they breeze in and they spout off 16 medical terms and they breeze out. And one of the biggest things I did in my role there was then the families and the patient are sitting there just shaking their heads, right? And
Right.
then the doctor and he'll go, "You got any questions?" And then he
We're
walks
in
out and they
shock.
go, we don't know anything he just said. And then I would explain, this is what this means. And I
Yeah.
thought, and they all would say to me, you need to write a book. So I did. And it's just, what's interesting is that book was published in 2014. So you're thinking, oh, I see you. It's way out of date. No, that and the rehab book that was its sequel book that was published in
Hmm.
17. I just had family members use it. They said it's still relevant. Everything in there, you wrote it so that it's general enough that it's still very relevant. So sequel book, so you get your family member better. They're out of the ICU, they're in rehab. Now what? Well, families don't know how to navigate a rehab center. They don't know what all those therapists do. They
Right.
don't know that they have the right to call a family conference at any time. They don't
Hmm.
have to wait for somebody. They don't know Medicare guidelines. What do you mean my family member can only stay 20 days? It's all in there.
Yeah.
And then the final chapter is okay, they're ready to go home. They just kick them out the door and send them home. Well, you can't even get mom off the toilet, or you can't even get dad in the shower. What in the world in the shower? What are you going to do?
Right.
So there's a section on the equipment that you'll need, places to get that equipment, how you set that equipment up, home health care. What is that? What's involved in that? People say,
Mm.
oh, I'm going to go have home health care. I'll get my rehab. No, they come be once a week.
Yeah.
The idea is you're working on stuff. So that's the rehab book. Well, my family's in Parkinson's book has been rattling around in my brain since 2018. And
Hmm.
I've been so busy with my studies and my teaching and my and that finally two of the board members at the Colorado Parkinson Foundation and my fabulous research team, Dr. Dawn White, Dr. Tim White, collaborated on a practical survival guide for families in Parkinson's disease. And
Incredible.
it's practical. Okay, you're having this side effect. What can you do?
Hmm.
Okay, you need this service. Where can you find it? Okay, you need this therapy. Who is that? What do they do? You need these exercises. How do you do them? Here are the common imaging studies you'll need. Here are the common medications and their common side effects and how to combat them. I wrote a nutrition chapter. Yes, I did. It's very short. It's very like flyover. It's not in depth, but I targeted the three top dietary um, interventions in the research, and that's a vegetarian diet, which is used widely in Parkinson's. It's not my diet of choice, but it's used widely, so I put it in there. The
Hmm.
Mediterranean diet, which also is very effective in Parkinson's. And of course, in my chapter, I talk about you might think about not doing really the grains and the fruit. And then, of course, the low carb ketogenic approach is probably the longer section. You can tell my bias there,
Mm,
and
definitely.
it gives them a flyover of the three different types of diets and some of the benefits of each. Because my patients who, for religious reasons, don't eat animal products, I honor that in them.
Hmm.
I can set them up a ketogenic vegetarian diet. I can. Now they have to eat dairy and eggs for their proteins,
Hmm.
but they can get into nutritional ketosis if they do the really good fats, the olive oils, the avocado oils, the coconut oils, um, and the eggs,
Oh yeah.
So we can get that customized for people who are primarily vegetarian. Now, vegans, Not so much. I have more trouble with my vegan patients just getting the adequate protein.
Yeah, it's a
Um,
real challenge.
yeah. And then the Mediterranean diet has many anti-inflammatory effects, really good effects. If you're not doing like the great Mediterranean diets are not pasta 3 times a day. They're not. They're very high in seafood, which is
Hmm.
wonderful, and
Yeah,
olive oil and those healthy fats. You can do a Mediterranean diet very well and have some good results. So,
definitely.
and then one chapter is all the research studies we've done and a summary of each of the studies and websites. There's a chapter on where the helpful organization websites you can go to. It's really the first of its kind that has all of that in it. My two board members from CPF had family members they've taken care of for years. And of course, they've been on the board. So I call them my Parkinson's experts. They know how to teach a family how to deal with this condition.
Yeah,
So,
those
yeah,
first two
I'm hoping it'll be
books.
published this year. I know.
Yeah, it sounds like a valuable resource for anyone, dealing with Parkinson's and their family. And the
Right.
first two books I would have been so grateful to have when I was dealing with my father-in-law's condition. When he
Right.
first came down with neuromyelitis optica. We were in the
Hmm.
ICU, and it was so challenging. Like you said, they're spouting out all these terms, and we would use the voice recorder app on the phone and record it, and then go back and like try to look up the terms. What are these guys talking about? And then when he came home
Right.
from the nursing facility, we had no idea how much was involved with the home health, and it's
Right.
really valuable to have those resources. And so those are available on Amazon.
Uh-huh. Yes, they are.
Awesome.
And really the beauty of those books is it'll inform you, empower you to be an
Mm,
advocate for your family member.
yeah,
One
you
of
have
my
to.
friends recently, they are guardians for his sister who has some dementia. She fell and broke her hip, ended up in the
Oh
hospital
no.
and then in rehab. And they said they're they're kicking her out. And I said, pull out my book,
Mm,
open it to chapter X, and it'll tell you exactly how to appeal the Medicare denial of service. They used it, they did it, she got extended stay.
that's
And then,
fabulous.
right. And then the therapists, bless them, were doing non-weight bearing with her. She could be weight bearing. She should have been weight bearing. It's like, okay, what is up here? I said,
Hmm.
open to chapter X, show the therapist that weight bearing is tolerated means she can put as much weight on that thing as she wants to put on it. So, they really used the book. And this was like a month ago.
Wow.
So I'm thrilled that the books came out to be, well, what they are is a reflection of my 45 years as an occupational therapist. I mean, it's
Mm,
all that stuff I did with patients and families.
yeah.
So, yeah, I'm sorry that you didn't have that kind of support. That's very, very
Yeah.
hard.
We figured it out, but it was definitely a journey, learning. We learned so
Sure.
much about how to navigate the medical system and insurance and all that. And
Oh, yeah.
luckily he's doing much
Yeah.
better. He's home now, and he's doing
Good.
outpatient physical therapy. And but it's,
Good.
there's always something. There's always a new hurdle to overcome, but we're figuring it out, and yeah, it's all good.
Well, I want that book and all of the books to empower people to know you are the quarterback on this team, not the medical team. You are.
Yeah.
You ask for what you need. They don't dictate to you what you're going to do. You
Hmm.
ask for what you need. You negotiate what you need. And in order to do that, you have to know what's going on. So, people don't know in an ICU that every doctor who walks through your loved one's door may not be their primary doctor. You have the hospitalist, you have the intensivist, you have the
Mm-hmm.
neurologist, you
There's
have the
so many.
cardiologist, you know, and you're trying to ask a question and you don't even know who you're talking to, right?
Yeah.
So it's really a challenge and it just gets away with me. In fact, if anything, my residents always knew when I was on duty because they'd kind of creep into the room with fear and trembling because I would not let them stand there and spout medical terminology.
Mm-hmm.
I would not. I'd say,
Yeah,
you
it's
need to
not fair to the
stop and
patients,
yeah, you need
families.
to explain what you just said, and they were like, oh no, Melanie's on duty. We better be on our P's and
Watch
Q's
out.
here. Yeah, yeah.
Amazing.
So,
Well,
yeah,
I think we covered a lot. Was there anything else you wanted to
we
mention?
did. No, I'm recruiting for my sixth study. If people are interested, they can email me at study@co-parkinson, no S, .org. And that email comes directly to me. I'm ending recruitment for the crossover trial the end of May 25. And, just I want everybody to know that whatever you're suffering with, the challenges that you're having, there's some resources for you.
Hmm.
And knowledge is power. You know, watch Josh's podcast, watch mine, watch others. Get that information and ask questions and be an advocate for yourself.
I love that. Thank you so much for sharing your time and helping us cut through the bullshit today. It was a real pleasure.
It's nice to see you again, Josh. Thank you so much for having me. You see, I get wound up about what I'm doing, but I hope to see you in San Diego this year.
I will definitely see you there. I'm excited for that.
All right.
All
Wonderful.
right.
Thank you.
You bet.